I'm Shaun Thompson. I live in Fort Morgan, Colorado. For the last 8 years, I've done full-time nursing home medicine. I'm a trained family practice doctor.
Thank you for being here.
Pleasure.
Now, you understand that these are extraordinary times. We're right in the midst of the COVID-19 pandemic. How has this been for you?
Yeah, it's a weird time. I think about doing nursing home medicine. I think that my residents have been through polio and other influenza and other pandemics, but I don't think we had the media exposure and the information flow that we have with this. And I think that's made it different. That's changed it. But it feels very surreal, and there's more and more restrictions and guidelines, and those kind of things are unprecedented in my career anyway.
Can you say how those restrictions have affected just your workday? What are you doing now or not doing compared to how it used to be? Just a few.
Right. Yeah. So I do full-time nursing home medicine, and so I just work in one nursing home. And so, starting 3 weeks ago, we closed off the front entrance, closed off to visitors, so only staff can come and go. In fact, even the pharmacy delivering medicines can't come in the building. They stop at the front door and leave things. So all staff comes in through an employee entrance and gets screened with temperature and screening questions. Have you been exposed to COVID? Have you had a fever? Any respiratory symptoms? And sanitize your hands there, put on a surgical mask, and then can proceed into work. So the direct providers, nurses, myself, CNAs wear surgical mask. The non-patient care providers can wear a cloth mask, because one of the challenges we're running into is shortage of personal protective equipment, and so trying to
work so far?
No, we're down mainly CNAs, but also nurses as well, either from their own illness or their own concern about something home, to their families. Mm-hmm. And so that's been a challenge too.
And how short are you? How short-staffed, and how much has that shifted the workload on the people who remain?
I don't know numbers. I know that our director of nurses the other day told me she had one CNA for the whole building for the whole night shift, which is usually, I don't know, probably 6 people. Mm-hmm. And some of the nurse managers who normally would be doing more administrative stuff are now back to more floor work, because there's, other people are not there. They got to fill in the gaps.
And what do you feel patients, they must be missing some kinds of care now, if you're that short-staffed. What are they missing?
I don't think there's any care issues. I think I think as far as what the patients are missing is family contact and the visitors. There had been a men's coffee club every morning, and there was a volunteer that would come in, or a group of volunteers that would sort of take turns, and so that's been shut down. Family visits, volunteer work, the group activities, those kinds of things have all been shut down. So I don't think the caregiving I think our staff has done a great job of filling in those gaps, but I think the sort of the social things and activities has been more impactful than the aides and the nurses.
Do you have families coming and hanging around the windows?
We have had some of that. Yeah. In fact, we had a lady who's 80, I think she had her 84th birthday the other day, and her family came, hung streamers in her window, and and the kids and grandkids kind of waved and sang to her through the glass, which is touching, but it's in a positive way, but also in a negative way too. It's unfortunate.
Yeah, I have an old friend who turned 90 yesterday. She's in a skilled nursing facility in the city in Chicago, and her kids came in the early morning and drew on the driveway a great big heart and "We love you, Jean, happy birthday" on the driveway before the traffic had all erased it, and called her to her window.
And she was able to see it.
And she was able to see it, and a granddaughter baked her a birthday cake, and
nice.
I think it had a file in it.
Trying to break out.
That's right. But yeah, I think people are doing whatever they can.
Right.
Do you? How's morale among the people who are still at work?
Initially, so I think we're 3 weeks into sort of these restrictions now, and our staff was really creative, and has continued to be, but they had, once we eliminated visitors and families, they had sort of dress up day. So the staff had dressed as your favorite Disney character, your favorite singer, I forget all the ones. And then the next week was different colors every day. So Monday was black and white day, and then there was wear pink, and today was, I think, butterfly day, and those kind of things, as silly as it seems, have really made a big difference with the residents. They've really enjoyed that and look forward to those kinds of things.
Did
so
you have
morale?
Did you have a butterfly outfit? And if you did, can I have a picture?
I did not get the memo. I didn't realize it was butterfly day till I got there.
Oh, okay. And how's your morale? How are you holding up?
It's okay. It's the longer this goes on, the more it's sort of become exhausting, and it's, I think, and I don't think I think we're probably delayed as compared to the public and the hospital because we've shut down, but I think our day is coming where it's going to be busier and more difficult and more sick people. Mm-hmm. And so I'm trying to sort of steel myself for that. But just this sort of, it's, for whatever reason, it seems like it's more exhausting than just a normal day, even though it's not even necessarily a whole lot different.
So it sounds like more it's an emotional burden.
Yeah.
Waiting for the second shoe to drop, maybe.
Yeah, exactly. And it's so, we're in uncharted territory, and not knowing what's going to happen, I think, makes it more scary. And then I worry about, are we ready for the next step or whatever, these people getting sick, those kind of things.
Right. So you haven't had a case in your facility?
We have not had a confirmed case. I've had, we've tested 3 people. The third one was just today, so that test is pending. I had 2 negative tests that we did on people with fever. Mm-hmm. So I guess that's been one of the other changes, is that the residents are getting screened multiple times a day with temperature and vital signs and looking for respiratory symptoms. And so we're finding fevers that we may or may not have found otherwise. And then that triggers a whole new, they move to an isolation ward and got to figure out why they have the fever.
Are they otherwise, so they're restricted to the rooms pretty much?
So everybody is restricted. If they come out of the room, they have to stay 6 feet from other people. So they're doing some hallway bingo and doorway exercise and activities and karaoke and that kind of stuff, but no group gatherings. But then we have a more restricted isolation sort of ward that is blocked off by double doors. So people, new admits coming back from the hospital or coming from the hospital, or people with any kind of symptoms or sort of these rule out patients are on that floor. And it's, the staff is more restricted there. And those, they're in their room with the door closed.
Mm-hmm. I know you have at your facility, a population of people who are confused, agitated, demented. How are you managing them?
Most of them seem to be doing okay. I worried that people wouldn't recognize me with a mask on, but I guess they recognize my forehead apparently or something. We really, and I've been worried about in people with, other kind of psychiatric issues. Again, so far it hasn't been too terrible. We haven't had those, behavioral or complication problems that I worry about, but again, it may be coming too.
I know Morgan County's already had some cases, haven't they?
Yes. Yeah, I think in the 40s, maybe last count.
Wow. And hospitalized patients?
Yes. I know there's been some in the ICU and maybe one death. I'm not 100% sure on all those statistics.
And at both hospitals in the county?
I think so. I know for sure Colorado Plains. I'm not sure about East Morgan County. I'm assuming they've had something, but I don't know for sure.
Well, I know that they've had some cases, and I know that I spoke to Aileen, and they've shipped some out, I think, already. So, do you know, have they had to send anybody out of county to a tertiary facility?
I don't know of any specific cases.
Uh-huh.
I know. I think there was. I guess can't say I know. I think there was one patient in the ICU on a ventilator at one point, but I don't know.
Mm-hmm.
That's been a couple of weeks ago, and I don't know what the.
So far, at least as far as ICU beds and ventilators, you haven't heard of an acute shortage.
That's correct, and that's one thing I worry about. And I talked with one of the hospitalists because I've heard initially. Like I heard a story of an ER doctor calling one of my colleagues who does nursing home medicine and said, don't plan on sending your patients because we're not going to have room or ventilators for nursing home patients. And so there's this worry about sort of that decision-making and triaging of care. And so I asked, is that going to be an issue? And at least at that time, that was a week and a half, 2 weeks ago, she did not feel that there'd be any problem. They could run enough ventilators and had enough beds. We're anticipating things would be okay.
That's good. Right now, it sounds like you've mentioned lack of personal protective equipment. Right now, that's one. What are your biggest frustrations with your situation?
Yeah, that's one of them. I think probably just sort of the worry, like where's this going to go, and do I have the skills and do we have the resources to deal with it, and what's it going to be like?
I want to ask you a question or two about the community. Just the way you describe how things are at the nursing home, and from my own experience, I know that when you're caring for people who you know and whom you've lived among, that's one of the beauties of rural practice. And it sounds like certainly that's happening at your facility. That the staff is doing a bang-up job of really caring for people in a very personal way, of tailoring what they're doing for what they need. How has in general, do you have a sense of how the community of Fort Morgan or the county have responded to this? For one thing, just are they being good about sequestration?
I don't know, because I don't see any of them. Because I'm being good about it.
Yeah.
I know, initially I think, and I was kind of in this camp too, this is overblown. I think this is way more than we really need. We're overreacting. This is, just too much. I don't think we need to wear masks when we go out, and we don't need to stay 6 feet, and I can still go visit my parents. And then I thought, it's not worth the risk. We don't know how virulent this virus is and how much sickness it's going to cause, and it's not worth the risk. And I feel like sort of the rest of the community has kind of gotten to that point too, that we have to take this seriously, and we do need to stay home and wear our masks and all those precautions. So I think it's gotten better as this has sort of progressed along.
And I assume businesses are shut down, except for...
There's some takeout restaurants. Restaurants can serve takeout, but the theater's closed. I think a lot of the retail is closed. Safeway and Walmart are still open, I think, for essentially business as usual. But a lot of other places are closed.
Yeah. Well, you started out saying something about past epidemics, which you and I haven't had to live through. Actually, my cohort, I'm a good deal older than you, Shaun, and there were kids in my class who had polio. And I remember when I was a kid, it was just that the vaccine just came around, and that meant an extra shot at the doctor, and we hated that. But and I know that in 1917 or 18, my grandfather lost his mother and a sister and a niece, and he was scared from then on. Have you heard echoes of past epidemics and past times among your patients at the nursing home?
No. My initial thought was these people had been through that, and you don't get to be 85 or 105 without being strong. My mom did tell a story when she was younger about the measles epidemic. And she and her brother got measles, and the health department or somebody came by and put a big sign on the door that they had measles and couldn't leave the house. So that's been kind of my own personal story with that.
Yeah. Well, everybody is hoping for a vaccine, but we know that's a long way away. And we just don't know what's going to happen. After we get through this, there's still going to be a lot of people who are susceptible, and one case could set it all off again.
Yeah, I have had weekly calls with sort of our corporate medical director type person, and we talked about that last week, that I don't know that we're eliminating any cases, we're just sort of spreading them out, and there's probably going to be clusters. Eventually when we leave our houses, there's going to be cases out there, and there'll be clusters and other outbreaks, I'm assuming.
Which brings me to another question. Where have you gotten, well, so you're the only physician in your facility.
Correct.
Which is a solo practice, essentially. Where have you gotten your professional support through this?
Mainly through that group. So the company I work for is Life Care Centers of America, which has nursing homes across the country. And there's a handful of doctors in Colorado, and so, but on a corporate level, we've had these weekly calls that has been helpful. The information, it's slowed down a bit now. The fire hydrant has been turned down a little bit, but initially there was, you would get 3 or 4 or 5 emails a day from different professional organizations and journals and et cetera, and to try to keep up, I guess that's sort of a double-edged sword, that there's so much information out there that it was valuable, but there's so much it's hard to keep track of. And have I read that article, and am I up to date on that? And this CDC guideline is different from yesterday's CDC guideline, and it's different from what CMS says, which is different from what our corporate people are telling us, which is different from what the health department, there's just so much, trying to gather and process all that information. It has been an issue, has been a tough challenge.
Yes. So that's professional support. How about personal support? How are you taking care of yourself through this?
I'm an introvert by nature, and so this has been great for me. I don't have to make up excuses not to go anywhere. of, and and in some ways, I mean, I'm not a real social type person anyway, so that's been okay. I don't tend to leave the house a whole lot anyway. I cycle a lot. I ride my bike a lot, and I haven't been able to get together with the guys for some of our group rides. So that's kind of been the biggest effect there as far as personal social interactions.
Mm-hmm. And then personally, I assume family and whatever else you use to keep yourself whole.
Yeah, we would normally eat dinner with my parents every Sunday, and we put that on hold. We had family Easter over Zoom yesterday, and have had more electronic communication than ever.
Well, I've asked you a lot of questions. Anything you'd like to offer or ask me? It's all fair game.
I think I would like your take. I've always been sort of not skeptical, but I'm not crazy about doing telehealth type visits. I think if that's all you can do, obviously that's a good thing, but an in-person visit is better. But I think telehealth has probably taken a huge step forward. The rules have been relaxed, and I think this is probably a giant leap forward for telehealth. And I guess I'd be interested in your take on if that's going to gain momentum, or what do you see in the future for that?
Well, I do think so. I think when Bauer and I wrote that book that came out in 1999 about telehealth, we asked the question, why isn't there more of it? And there are a lot of reasons why there wasn't then, because it certainly makes sense in terms of convenience, in terms of efficiency, of cost, of all sorts of things. But the world has turned. The technology is way, way better and more, here we are, and more reliable than it used to be. And the ideal that everybody has a personal doctor whom they see personally when they need something has just never been realistic. That would be lovely, but I think but we know there's a whole lot that we do anyway. It's telehealth. We've been doing it on the telephone. That's telehealth. That's care at a distance, and we've never been paid for it. So I think that whole world is changing. Of all the things that will change when the epidemic is over, I think medicine is due for the biggest. Healthcare is due for the biggest. And I hope some of it is good. People will have will have more access to care, rather than just not go or go to the emergency room and get a bill that's $2,000 for a cold. So I think the time has come.
Yeah, I think this will be a spark for some of that.
Yes. Anything else you'd like to say?
This sort of corporate medical director person I was telling you about has always been very complimentary and encouraging. You're doing good work and you're not out there alone, and those kinds of things, which, for years he's done that. And initially I kind of thought that's sort of just fluffy and warm hugs, but through this I've learned that does make me feel better. And I've tried to be more encouraging and tell people, thanks for coming into work today, because not everybody did, to care for these, in my, the vulnerable people, especially in our population. And so that's been, kind of an improvement, I guess, a self growth period for me to see the value of that. And by encouraging others, it's helped me, personally, to have some strength, I think, to keep showing up and keep going on, because these other people are doing it too.
I admire the work you do. And these technologies themselves, like us being able to talk here and support each other, just know each other that much better. You know, any tool is neutral. It's how you use it. And I hope we'll use this well.
Yeah, I think facilitating those connections, however they may be, is a good thing.
Yes. So, anything else you'd like to cover, or Erica, is there anything that jumps out to you that you'd like to hear?
No, I really appreciate the aspect from the nursing home perspective, because I was on a call this morning, and basically they said there's been 68 outbreaks throughout the state, and the majority of those are in nursing homes.
Yes.
So it's really good to see the proactive measures you guys have taken, and it's great to learn those pieces.
We just cross our fingers and hope it's effective.
Right.
And to see the human side of that too.
Absolutely.
It's critical.